Service Reform Committee will come to order. We do have a quorum. Representative Peterson moves the minutes from March 8th. Are there any additions, corrections, or changes to be made to the minutes? Seeing none, all those in favor of approving the minutes signify by saying aye. Aye. Opposed, same sign. The minutes are adopted. First up today is House File 3240. Representative Haley. As she makes her way forward, I move that House File 3240 be referred to the Committee on HHS Finance. We have the bill in front of us. Representative Haley, I understand you have an A1 amendment.
Yes, good morning, Chair.
I will move the A1 amendment. Representative Haley, to your amendment.
Thank you very much. When the bill was first introduced, there were a few outstanding issues that needed to be resolved with the Department of Health and some providers. So that's what we did with the author's amendment. So unless there are any questions on that.
Are there any questions to the A1 amendment? Seeing none, all those in favor of the A1 amendment signify by saying aye. Aye. Opposed, same sign. The amendment is adopted. Representative Haley, to your bill as amended.
Thank you, Mr. Chair and committee members. I'll just give you a high level of House File 3240, and I'll allow Kevin to go into the details. Basically, this modifies some licensure requirements of home health care agencies in Minnesota. The bill was brought to me by the Minnesota Home Care Association on behalf of the providers and others with expertise on these issues, including Leading Age Minnesota and Care Providers of Minnesota. This is the culmination of over 5 months of work with these folks. Over the years, individuals involved with home care licensing have identified licensing statutes that were sometimes unclear, unworkable, or outdated. This caused questions as to what was expected for compliance and if the law would be applied consistently now and in the future. I'll just give you one short example. A statement about the supervision of direct care workers was required in the service agreement between the providers and the clients. This requirement was often cited as being in violation on surveys, simply because the provider failed to include it. It was determined that in many cases it was omitted because they just didn't understand that what was required. So there are other details in this bill, but it falls along the similar lines of just clearing up some of these licensure requirements. With the addition of the amendment, as I said, I'm not aware of any other opposition to the bill. And Kevin Goodnow is here on behalf of Minnesota Home Care Association, and he will walk you through the details of the bill. Thank you, Mr. Chair and committee members.
Thank you, Representative Haley. Mr. Goodnow, welcome to the committee. Please state your name for the record and present your testimony.
Mr. Chair, members of the committee, Kevin Goodnow here on behalf of the Minnesota Home Care Association. I appreciate the opportunity. There are 31 sections to this bill, but it's basically does about 11 different things with a few subparts. I'll try to go through those at kind of a medium level rather than get down into the weeds too much. But as Representative Haley mentioned, it really, this is a culmination of work. We have folks that kind of collect their biggest concerns when they're dealing with home care licensure statutes. They've accumulated that over a period of time. We came together with the Department of Health to reach agreement on how we can address those things. And in a lot of cases, it's just really clarifying existing statute or codifying existing practices. So when you look at Section 1, and actually there's 7 sections related to clarifications around medication administration. Those are found in Sections 1, 2, 19, 20, 21, 22, and 23. There's really no, again, substantial change there. It's just clarifying language. We have in 5 sections of the law making it consistent that we use service agreement rather than service plan. Section 4 is just regarding a definition of standby assistance. This is actually a situation where we had come in with a different solution to this, and Department of Health said, you know what, your solution doesn't make sense. This is one of those things where people weren't understanding what standby assistance meant, and because of that misreading, they were actually needing to get a higher level licensure than they actually needed in order to provide low-level services. So with this definition, it clarifies what's included as standby assistance and the fact that you need only a lower license rather than a comprehensive license. There are 5 sections in the bill related to change of ownership. This was a situation when a home care provider changes ownership. This clarifies the transition of the employee training from one owner to the next. It updates language and modernizes language with regard to entity structures. With LLCs and stuff like that, we wanted to be clear on what that meant. And also triggers a survey within a period of time, 6 months, with the change of ownership. There are about 8 different sections in the bill that relate to start of services. Some of that is just clarifying the language as to when start of service actually begins. You would think that'd be easy, but we spent an awful lot of time trying to be precise about that and making sure that it did not mean when the agreement was signed, but when there was actually a provision of service. That's important because it triggers a number of other things that happen after that provision of service starts. There also is, and we worked with the Department of Health as we were having these conversations, other issues were identified. And one of those is that when we have a new provider, they're issued a temporary license. They may not be serving anybody at the time they're issued the temporary license, but they're required to notify the Department of Health when they start actually providing services to individuals, and that triggers the requirement with a certain period of time that they actually have to be surveyed. There are a number of people that weren't complying with that law, so we've added, and this is just a note, a fee of $1,000 if you're not compliant with that timely notification. And our hope as providers is that when new providers come in, that they are surveyed in a timely manner after they start to provide services. We want to address any concerns that people have up front rather than after the fact. There's a couple provisions and sections in the law with regard to transition of clients if a home care provider has their license suspended or revoked. The current law is kind of silent on that, but you don't, and this is if the clients aren't facing life and safety issues, but we need to have an orderly transition from the old provider to a new provider for those folks. We just can't cut off service at any specific time. In the service, there's also 3 sections related to disease prevention and infection control. Really no new requirements here. It modernizes the language with regard to that and consolidates it in one section of law so it's easier to identify and find. In the service agreement, that's the agreement that's signed between the provider and the client. There are 2 issues that we asked for clarification on. Representative Haley mentioned one of those, where we just want to go with a clearer understanding what's required. So it's easier for people to comply, and then from MDH's perspective, it's easier for them to identify violators as well. And then there's a couple sections just about clarifying when orientations, who has to be involved with the orientation section. That section is 24. When supervision applies, it's 25. Again, it's just technical clarifying language. In sections 27, 28, there's home care and assisted living program advisory council, some tweaks to that language as well. And finally, in section 29, there's the deletion of obsolete language that, well, it's obsolete. So I'll stand for any questions. Appreciate the opportunity to present the bill to you today.
Thank you, Mr. Goodnow. Are there any questions for Mr. Goodnow? Seeing none, the committee thanks you for your time this morning. Is there anyone else who wishes to testify on House File 3240? If you could please make your way forward. Welcome to the committee. Please state your name for the record and present your testimony.
Thank you, Mr. Chair. My name is Josh Berg, Director of Services for Accessible Space, Inc., and former Program Manager at the Department of Health over the HCALP section. I'm full support of this proposal and this bill. Worked with Leading Age last year as we were kind of going through some of these details. Getting out front and being proactive to make sure that we're preventing these issues from happening in the first place is the key, and I think that's what a lot of this addresses, especially with the temporary license piece of this. I would encourage anybody to continue to talk about, though, that piece of it and that preventative part, because I think there's more that can be done when it comes to prevention, as far as getting out in front of before a license is ever even issued. The language really tightens it up and makes sure that a new temporary licensee gets surveyed within 90 days, but a lot can happen in 90 days. And a lot of these places take over a year to be built, and they have wait lists that are ready to go. So as soon as that license is issued, they are packed full of people already moving in. So I encourage you to look in the statutes, and it doesn't even need legislative changes. If you look at 144A 473 subdivision 1, it gives the department authority to ensure that prior to issuing a temporary license, they make sure that that applicant has the knowledge and can actually implement the regulations as they are there. So and when I was at the department, we tried out some different practices and tried out some different ways of doing that, and I'd be happy to discuss that with anybody. We have some good data to show that applicants self-selected out after they realized they were in over their heads and decided this wasn't for them, and they didn't want to be placing them at risk from a business perspective, and then taking care of vulnerable lives without having the knowledge and the understanding of the regs. So great bill. I think it's a really cool thing. It'll be interesting to see how this all plays out with timelines of surveys and everything, but we'll kind of let that be. Thank you.
Thank you, Mr. Berg. Questions for the testifier, Representative Liebling?
Thank you, Mr. Chair. Good morning, Mr. Berg. Thanks for your testimony. Just one further question. This addition of the fee of $1,000 for failing to comply with notification, what's your take on that? Is that something you feel like is that necessary? Is it not adequate? I mean, do you think, how's that going to impact things from your point of view?
Mr. Berg?
Mr. Chair, Representative Liebling, I think it's great. I mean, I think it was one of those statutes that had no teeth behind it, no anything behind it, and from my perspective, when I was at the department, and I'm sure even now, there's so many providers that start providing services, fail to send in that notification. The department then doesn't have any idea, and then they're out there 6 months after they actually start providing services, and now they got 100 individuals living in their building. So I think this is a great start. Now, whether it'll incentivize or prevent it from happening, who knows? But it's something. So I think something was definitely needed.
Representative Liebling?
Thank you.
Any other questions for the testifier? Seeing none, the committee thanks you for your testimony today. Is there anyone else who wishes to testify on House File 3240? Seeing none, final questions from members? Seeing none, final word, Representative Haley.
I know you have a full agenda, Mr. Chair, so thank you for listening to the testimony, and I appreciate your support on the bill.
With that, I will renew my motion that House File 3240, as amended, be re-referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 3240 is, as amended, is re-referred to the Committee on Health and Human Service Finance. Thank you, Representative Haley. Up next this morning is House File 3061, Representative Dean. As he makes his way forward, Representative Dean moves that House File 3061 be re-referred to the General Register. Representative Dean, when you are ready, to your bill.
Thank you, Mr. Chair and members. This bill is a technical change from the Department of Health. This funds residency slots for primary care in the state. And what this bill does is it makes a small change with the existing grant appropriations to move from a 3-year residency to a 4-year residency. And what that does is it will enable psychiatry residents to take advantage of this. Psychiatry is a 4-year residency, not a 3-year residency. So this would allow psychiatry residents to be able to take advantage of this and would provide more primary care mental health providers within Minnesota for those slots. That's all the bill does, doesn't spend any money, and that's why it's going to the General Register. Be happy to answer any questions. Also, anyone from any questions for the department, we do have somebody here from them. So with that, I'd entertain any questions. Appreciate support.
All right, is there anyone who wishes to testify on House File 3061? Okay, are there questions from members? Representative Liebling.
Thanks, Mr. Chair. Thank you, Representative Dean. Is this just for psychiatry?
Chair Dean.
Mr. Chair, Representative Liebling, it is not. It is any residency that within primary care, and those are family medicine, internal medicine, pediatrics, psychiatry, geriatrics, and general surgery.
Representative Liebling.
Thank you, Mr. Chair.
Any other questions for the bill author? Seeing none, final word, Representative Dean.
Appreciate your support.
With that, Representative Dean renews his motion that House File 3061 be re-referred to the General Register. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 3061 is re-referred to the General Register. Next up this morning, Representative Kiel. And House File 2987. As she makes her way forward, Representative Kiel moves that House File 2987 be re-referred to the Committee on Civil Law and Public Safety. Welcome to the committee. Please present your bill.
Thank you, Mr. Chair and members. Miss Rowan came and joined me, or came to my office this summer and asked if I was interested in looking at a drug repository bill and helping to save some dollars cost in drugs that could be shared, I guess would be a comment. But with that, and I know how busy we are today, so I'm going to ask Rowan if she would explain to you what this bill does.
Welcome to the committee. If you could please state your name for the record and present your testimony.
Hi, my name's Rowan Mann, and I am a pharmacy student and a public health student at the university, and I'm here today representing a student organization that brought this bill to Representative Kiel. So basically, this bill looks at long-term care facilities. When a patient's there, they generally get their medications packaged individually for a few weeks, and if the patient doesn't need those medications anymore, if they get switched, or if something happens and they no longer need those medications currently have to be thrown away. And that doesn't seem like it would be that big a deal, but in 2014, a study was conducted across the United States, and it was estimated that $2 billion worth of safe medications are being thrown away yearly at these long-term care facilities. Colorado did a state-specific study, and they found out of their 220 long-term care facilities, they were wasting $10 million worth of safe medications. For comparison, Minnesota has 365 long-term care facilities. So we're throwing away medications that are still safe, but there are still many patients who cannot afford medications. I work at North Memorial Hospital, and every shift I talk to at least one patient who is not taking their medications because they just can't afford them. So what a lot of states have done, what 20 other states have done, is they allow long-term care facilities to donate those safe medications that have just been repackaged for another patient, and allowed them to be donated to a medication repository program that can then give those medications to patients who otherwise couldn't afford them. This language was heavily modeled after Iowa, and Iowa's program has been running since 2018, and they've helped over 71,000 patients. They have been able to donate out over $17.7 million worth of medications since 2018. Wyoming is another great example. They've been operating since 2007. They have filled over 150,000 prescriptions worth over $12.5 million. This piece of legislation is supported by the Board of Pharmacy, the Minnesota Public Health Association, and the Minnesota Nursing Association. And Dr. Weiberg of the Board of Pharmacy actually helped to rewrite this entire piece of legislation. Are there any questions?
All right, and before we move to questions to the testifier, Representative Kiel, you have two technical amendments to get the bill into the order that you wish to present it. Representative Kiel moves the A4 amendment. Representative Kiel, to your amendment.
Thank you, Mr. Chair. The A4 was just to, like you said, technical amendment that would clean up some details in the for the drug manufacturers or the prescription drugs that would be dispensed.
Right, are there any questions on the A4 amendment? Mr. Chung.
And Mr. Chair, if the A3-1 amendment is to be adopted, then on the A4, staff would suggest deleting lines 14 and 15. They amend the same lines of the bill.
Okay. Representative Kiel, do you wish to make an oral amendment to strike lines 1.14 and 1.15?
Yes, absolutely.
All right, are there any questions on that oral amendment? Seeing none, all those in favor of the oral amendment to strike on the A4 amendment to lines 1.14 and 1.15 signify by saying aye. Aye. Opposed, same sign. The amendment is adopted to the A4 amendment. Are there any questions to the A4 amendment as amended? Seeing none, all those in favor of the A4 amendment as amended, please signify by saying aye. Aye. Opposed, same sign. The amendment as amended is adopted. Representative Kiel moves the A3-1 amendment.
Correct.
Representative Kiel, to your amendment.
Just cleans up some language that after some discussion needed to be, and I don't know if Mr. Chung would like to add to that or not.
Sure.
Mr. Chung.
Mr. Chair and members, this amendment clarifies that if you have a If you have prescription drug coverage, then you would not be eligible to participate in the donation program, and instead you would go through the health plan's formulary exception process.
Questions for Representative Kiel on the A3-1 amendment? Representative Liebling.
Thank you, Mr. Chair, and to the testifier, thank you very much for bringing this forward, and you can see I'm a co-author on the bill. But what Mr. Chun just explained, I have a question about that, because lately we've been hearing a lot about some people have prescription coverage, but they actually end up paying more under that coverage than they would sometimes for a drug if they didn't have the coverage. You know what I'm talking about? Mr. Chun, maybe Mr. Chun can kind of address this because of the change that you just described, that under this amendment, that if we adopt this amendment, that the bill wouldn't apply if you have prescription drug coverage. I think that was what I understood you to say.
Mr.
Representative
Chun.
Liebling, yes, that's correct. The bill, I guess, doesn't affect, those situations perhaps where the patient ends up paying more, because of a higher copay, for example. It doesn't address that issue. It just addresses who's eligible for the donated drugs.
Right, so, Mr. Chair.
Representative Liebling.
So maybe Mr. Chun could best answer this then, or if the testifier can answer it. So would this not then, that part of it, hurt people who have coverage, but have coverage that, is expensive for them in terms of the copay for the drugs they need?
Mr. Chung.
Mr. Chair, Representative Liebling, I think it would depend on the drug coverage, and I guess if a person did have drug coverage policy that perhaps wasn't very favorable for them or didn't cover very many drugs, then they would perhaps be hurt by this provision. This is a provision that I think was kind of worked on or requested by some of the health plans, and they might be able to answer some of these questions as well.
Yeah, thank you, Mr. Chair, and I see Ms. Commit just came to the table to do just that.
Welcome to the committee, Ms. Commit. If you could please state your name for the record and present your testimony.
Thank you, Mr. Chairman and members of the committee. My name is Catherine Commit, and I'm here for the Minnesota Council of Health Plans. And thank you for the consideration of this amendment. Essentially, what it would do is fix the language. We were concerned that it would allow individuals who have health insurance, including drug coverage, to bypass the formulary and the formulary exceptions process. So we think what this bill is really designed to do is to help people who don't have insurance and can't access these medications to be able to have a way to access those medications. But for people who have insurance, we want to be sure that they are able to use the formulary process that exists today.
Representative Liebling.
Thank you, Mr. Chair. Well, able to use the formulary process. So from the patient's point of view, what does it mean to be able to use the formulary process?
Ms. Commit.
Mr. Chairman and Representative Liebling. So I think what you might be getting at is it affordable? And that certainly is a public policy issue that we all are struggling with. Is drug coverage affordable? Certainly drugs are very, very expensive. But when somebody has coverage through a health insurance plan, they should be able to call up their carrier or work with their physician or provider to be able to get an exception to a formulary or to look at the formulary to see what the drugs are that are covered for a particular class of drugs. So they do have, most people have coverage. We were struggling to figure out who would buy coverage or what employer out there in Minnesota would possibly offer coverage to their employees without drug coverage, and we cannot think of anybody who would do it. So I think nearly everyone who has coverage today, it has drug coverage.
Representative Liebling.
So, Mr. Chair and members, I did not really hear an answer to my question. We know that a lot of people have drug coverage that's really inadequate, that they end up spending a lot of money on their drugs. And I do not understand. I mean, I think this bill is a great idea. And I do not understand why, because somebody has drug coverage, that they should not be able to use this program in a case where their drug coverage could be very expensive for them. So you said there, that it's, something about bypassing the formulary, and I really don't understand how it will benefit patients to be exempted from this bill if they have pharmaceutical coverage. I don't understand that. Maybe the bill author could come, or the testifier could come back to the table and explain to me if she knows, or maybe Representative Kiel.
A follow-up, Ms. Commit.
Yes, thank you, Mr. Chairman and Representative Liebling. What we don't want to have is people who already have coverage to go outside of that process, try to get a particular drug through the drug repository program, and end up being on that drug and then wanting to come back in, and it just creates so many different problems. People have drug coverage, people who are insured typically have drug coverage, and there are processes in place in order for them to be able to access those drugs. And if it's not the right drug, to look at a formulary exceptions process and that sort of thing. With respect to the question about how expensive drugs are, I agree with you. They're really, really expensive. And unfortunately, more and more products that are out there look at trying to share some of those costs with enrollees. We've got to do something about drug costs, so I agree with you about that. But for people who are insured, they have coverage, and it's best if they work through that process in order to ensure that they remain within the system and that their care can continue to be coordinated.
Representative Liebling.
Well, Mr. Chair, I mean, this is, I think this bears a lot more discussion. This is an amendment to the bill. I assume that this came in probably at the request of the health plans. I'd really like to hear what the author has to say about it, and more importantly, even what the proponent of the bill has to say about this, because I don't think this was in the original, this was part of the original idea. And maybe you could tell us, what other states are doing with regard to this issue.
Ms.
Yeah.
Mann, welcome back to the committee. Go ahead with your testimony.
Thank you, Representative Schomacker. So I was just talking to Dr. Weiberg about this, and no, this was not in the original draft of the legislation. I do not believe that it needs to be in there, but I also do understand the point of it. There will be a limited supply, especially at the beginning, of medications. It takes a while to get these. As Iowa or Wyoming, each year they get more donations, and each year they have a more powerful program. So there will be a limited number of medications to begin with, and making sure that those go to the patients who have no safety net at all. That would be very important to this bill, and kind of is what this bill is trying to do. In Iowa's language, they actually rank it out. So where the first line of individuals would be the ones who have no health insurance, and then they go down to number 2 of the patients who cannot afford them with their insurance. So that's how other states have done it, and that is
Representative Liebling.
Yeah, thank you, Mr. Chair. Thank you very much for that explanation. So, say in Iowa, so you have a priority if you have no coverage. That's certainly understandable. But we know there are many patients who have coverage and still can't afford. And so, to me, it just makes no sense at all to just exempt those and say they can't use the program. So, I mean, I've just, from what I've heard here today on this, I'm going to oppose this amendment. And, if other members decide that it's okay to exempt people who, just because they have coverage, whether or not they can actually afford their drugs, then, I hope we can work on this going forward, because I think it's a very good bill, and I just don't see a reason, notwithstanding that obviously the health plans don't want this in there for reasons that are still a little bit opaque to me. I think that, I don't think we should put this amendment on.
I think that we should
Mann.
rank them if we need an amendment for it.
Okay.
Representative Kiel.
Mr. Chair and members, part of this is not creating an incentive. We don't want to create an incentive for people to go outside of their coverage, and that's the reason for the amendment. in my mind.
Any
So,
further discussion on the A3-1 amendment? Seeing none, all those in favor of the A3-1 amendment signify by saying aye. Aye. Opposed, same sign.
No.
The A3-1 amendment is adopted. Representative Kiel, to your bill as amended.
Thank you, Mr. Chair. I believe that at the, as it stands now, this would be a very effective help for people who are looking for medicine. As Rowan explained, keeping our citizens who, especially our seniors who need to make sure that they have access to medicine, and especially when they can't afford it, helps to make them available for them. And with that, I guess I would ask you to support the amendment.
Is there anyone else who wishes to testify on House File 2987? Seeing none, final questions from members. Final word, Representative Kiel.
Please support the bill.
With that, Representative Kiel renews her motion that House File 2987, as amended, be referred to the Committee on Civil Law and Public Safety. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 2987, as amended, is referred to the Committee on Civil Law and Public Safety.
Thank you.
All right, next up is House File 2919.
Thank you, Mr. Chair. I was going to get up and leave, but I'll stick around.
And members, for clarification, we'll get that fixed. 2919. All right, Representative Kiel moves on House File 2919 be referred to the Committee on Health and Human Service Finance. Representative Kiel, to your bill.
Thank you, Mr. Chair. First of all, I thank you for putting this in this order. I've been honored to have my public health director from Polk County join me today. This just expands a little bit telemedicine. I really think that this is a important and very helpful for rural Minnesota, how we can help our friends and neighbors that are a little farther away and be consistent about their health care. With that, I will ask, I can't remember, do we have an amendment that we need to pass here? Maybe you'd like to do that before we hear the
Representative
bill.
Kiel moves the A2-1 amendment. Representative Kiel, to your amendment.
This gave some comfort to the county paramedics, and if you would like to hear from them, Mr. McAlpin, I believe, is here. Yep, right behind me. As far as how they address the telemedicine issues. So,
Mr. McAlpin, welcome to the committee. If you could please state your name for the record and present your testimony.
Mr. Chair and members, Buck McAlpin on behalf of the Minnesota Ambulance Association. We were also looking at doing this session with our community paramedics across the state. And we're somewhat like the community health workers, where we're certified and work under a scope of training and don't have a scope of practice. And the other licensing boards have scope of practices. So when the community health worker bill popped up, we went and visited with Representative Kiel about amending the community paramedics into the telehealth option 2. You'll hear another bill Thursday that Representative Dean has. We're doing lots of work around trying to look at addressing the opioid crisis and our chronic care management. And we find when patients come into the healthcare system, they leave long distances outside of the metro, and there's ways we could use our telehealth to have some of our community paramedics follow up with these folks. So we'd appreciate the support to the amendment to add them into this bill too.
Are there any questions for the A2-1 amendment? Seeing none, all those in favor of the A2-1 amendment, please signify by saying aye.
Aye.
Aye. Opposed, same sign. The motion prevails, and the amendment is adopted. Representative Kiel, to your bill as amended.
thank you, Mr. Chair. House File 2919 revises the telemedicine statute to allow local public health providers to bill MA more than 3 times per week per enrollee for telemedicine services provided to treat and control infectious disease. It also adds certified community health workers to the list of eligible telemedicine providers. With that, I will ask Ms. Reese. I'm sorry, I've known her since she was a young kid, so I have to stop and think about her last name. Anyway, to testify.
All right, welcome to the committee. Please state your name for the record and present your testimony.
Mr. Chair and Committee, my name is Sarah Reese, and I am the Polk Norman Monoman Community Health Services Administrator and the Polk County Public Health Director. Today I'm here on behalf of our Community Health Board and our local public health department in Polk County, as well as representing the local Public Health Association. Our association, or LPHA for short, represents 220 public health directors, supervisors, and community health administrators from public health departments across the state of Minnesota. Today I'm here in support of House File 2919. This makes small changes to the telemedicine statute to support the treatment and control of infectious disease, one of the cornerstones of our role in public health. I would like to thank the committee and Representative Kiel for her leadership on this issue. Local public health is mandated by state statute to prevent the spread of infectious disease. For diseases like tuberculosis or TB, this can require daily, directly observed therapy, sometimes taking 6 months or greater. Known as DOT, this means that a public health nurse or a community health worker must meet with the patient daily and see them taking a pill. People from all different educational backgrounds, ages, gender, race, and ethnicity can have problems taking medications correctly. The intent of our work is to increase the likeliness that treatment is completed successfully and on time, to prevent the transmission to others, and decrease the risk of drug-resistant TB while meeting state statute to prevent the spread of infectious disease. The staff time and related expenses for this type of treatment add up quite quickly. For example, in 2017, 10% of our Polk County Public Health Agency budget for disease control and prevention was used for tuberculosis. In rural areas of the state, geographic distance and workforce shortages pose additional challenges to us providing treatment. Telemedicine provides local public health with a unique opportunity to innovate our service delivery by allowing qualified staff to witness DOT virtually. In short, providing the same service provided through a more safer and efficient method. Eliminating the need for daily travel, sometimes 45 minutes or miles in one way. Public health staff save time on travel expenses, and it frees us up to see other clients. Scheduling also becomes more convenient for our clients too, because one way or another we have to see them. These benefits, however, are limited by the current telemedicine statute, which limits the billable visits to 3 per week per enrollee. So if we use a telemedicine model, we can currently bill 3 times per week per enrollee. It also excludes community health workers. These are people who understand the experiences, language, and culture of the populations that they serve, and that makes them key service providers. The bill before you seeks to do 2 things. First, to remove the 3 visit per week coverage limit for services provided for the treatment and control of infectious disease, and second, to add certified community health workers to the list of eligible providers. Currently, local public health providers, our very own public health nurses, are able to provide up to 7 days per week for services like DOT, assuming that they are provided in person. This is used to treat and control infectious disease like TB that I was mentioning. And certified community health workers are currently eligible to bill medical assistant assistance for in-person visits as well. In this way, the bill does not expand or change the services that are billed or by who, just how they can be provided using a virtual method. This is a good bill for rural Minnesota and Polk County. This bill is not looking to add anything that is not already billable. These small changes would promote cost and staffing efficiencies and reduce barriers to treatment that would better support our local public health efforts to prevent the spread of infectious disease. We ask for your support, and I'm happy to answer any questions that you might have. Thank you.
Questions for Ms. Reese? Representative Liebling.
Thank you, Mr. Chair, and thank you very much for your testimony. I just want to be really clear, the addition of the community health workers and the EMS people, is that just for purposes of this infectious disease telemedicine, or does that have broader applicability under the bill?
Ms. Reese. Mr.
We'll let
McAlpin.
Mr. Chair and Representative Liebling, Buck McAlpin at the Ambulance Association. Representative Liebling, it would be for chronic care management, following up with patients, everything that we're allowed currently to do under the medical assistance piece where we're paid under 256B for services.
Representative Liebling.
Thank you, Mr. Chair. Well, I just kind of remember when we started to allow this in the first place. And I thought the point was that these people are widely distributed in greater Minnesota and could get there and be there with a patient, whereas, otherwise they might not get service. And now we're saying, well, it's okay for them to now provide their service through telemedicine. So I don't know, that just seems like kind of goes against the original purpose.
Mr. McAlpin.
Yeah, Mr. Chair, Representative Liebling, I think we always prefer to have face-to-face visits. There's about 250 community paramedics, give or take, across Minnesota now. All the major healthcare systems have them, from Rochester and North Memorial, Health East, Hennepin County, Alina. They're pretty dispersed, and systems like Staples in them, so they do prefer that. But what we're running into, like anything, is we're just seeing large number of patients that we're visiting quite often, some daily, and they just require so much contact that the CPs thought that the telehealth was another great option, because lots of it's simple questions that would save them driving 35 miles to answer a question about a medication or how much insulin they should drop if they don't understand their vial and syringe and things like that.
Representative Liebling.
So, Mr. Chair and to the testifier, yeah, I mean, I get that. I mean, it's easier to do it by telemedicine, but I mean, the whole purpose of allowing community paramedics to do it was to be able to get there, I thought, and that we didn't have enough, say, nurses. I mean, I kind of remember this whole fight about who should be able to provide this service, and I think the argument was, if we had community paramedics doing it, we were able to get to people. So I just want to kind of put that out there. Is there, maybe to Representative Kiel, is there, maybe other testifiers are going to come down, but is there anybody who's opposed to this bill?
Representative Kiel.
Mr. Chair and Representative Liebling, not that I'm aware of. I think we have to think in terms of, it isn't that they are never going to be seen by somebody in person. It is that it saves some of those days of distant driving, and for the sparse staff we have in rural Minnesota, it really helps them to make sure that they can answer probably more than, I'm sure that it is challenging to get to everybody on a given day. And so this helps for some of the patients, some of the time. Maybe Ms. Reese wants to also reply.
Ms. Reese.
Thank you. Mr. Chair and Representative Liebling and committee, our public health nurses, when we provide directly observed therapy or DOT, we are seeing these patients for 6 months and generally up to a year. And so this provides an opportunity for patients to meet with us at a convenient schedule that's good for them. It's a service that we're already providing. We already can bill for up to 7 days of in-person contact. So individuals who are following their prescribed medications, this is a really convenient way for them to quickly be able to follow through with their medication regimen, to finish their treatment timely, prevent transmission to others, and also decrease their risk for drug-resistant TB.
Any other questions, Representative Liebling?
Well, thank you, Mr. Chair. And, thank you for that. I mean, I have no problem with that. We had a presentation on drug-resistant TB, and it's a huge problem. I think I'm absolutely on board with that part of this. But the other piece of this, as was just explained, is that, telemedicine now is being made available for use by community paramedics, generally, not just for this purpose. And that's kind of the thing that I'm raising as an issue. But, maybe we can kind of continue to talk about that. But sometimes one thing kind of gets piggybacked onto another thing, and I think that's what's happening here. It's a great bill, in the sense that, for this, I think it's super important to make sure we get compliance. I mean, we heard, you didn't talk about it today, but we heard from the Department of Health the other day about the incredible cost of drug-resistant TB and how long you have to treat people. I think it was like 3 years sometimes. And if they're not taking those medications, it's a serious public health impact, and a lot of that's in greater Minnesota and so on. So I think this is a great bill to respond to that. I have absolutely no problem with what you're describing. I just don't know if we want to also bootstrap in here letting community paramedics use telemedicine for every purpose. And that's what I understand the bill is also doing. So just wanted to flag that. But, I'm obviously not going to oppose the bill for that reason, but I think we need to continue to talk about that.
Thank you, Representative Liebling. Representative McDonald.
Thank you, Mr. Chair. My question was answered. Thank you.
All right, are there any other questions for the testifiers? Is there anyone else who wishes to testify on House File 2919? Final questions for the bill author, members. Final word, Representative Kiel.
Thank you, Mr. Chair and members. I would really appreciate the support for this bill. I really think that it will promote cost efficiencies and reduce barriers to treatment at a local level, especially in our rural areas of Minnesota. So thank you with that.
With that, Representative Kiel renews her motion that House File 2919, as amended, be re-referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye. Opposed, same sign. The motion prevails, and House File 2919, as amended, is re-referred to the Committee on Health and Human Service Finance. Next up, members, we're going to do a series of bills from me, House File 3191, then House File 3193, and then House File 3169.
The next bill on the agenda is House File 3191. Chair Schomacker moves House File 3191 to be re-referred to the Committee on HHS Finance. Chair Schomacker, I understand that you have an A1 amendment. Is an author's amendment. Would you like to move that amendment?
Thank you, Mr. Chair. I will move the A1 amendment. This amendment reflects the recent federal direction on the 7% rate cut, and we use this amendment as a way to stop that.
Any discussion on the A1 amendment? Seeing none, all those in favor say aye.
Aye.
Opposed, same sign. The amendment passes. Representative Schomacker, please give a brief explanation of your bill as amended.
Thank you, Mr. Chair and members. This bill, as amended, stops future 7% rate cuts from the individual rates and adds stability to the rate system moving forward. The legislation introduces the competitive workforce factor that is added to the rate framework. This factor is based on analysis that shows that wages of direct support professionals lag behind others with similar training and education by about 11%. The factor value in this legislation is 8.35%, the level necessary to restore the 7% rate cut, but does not address the entire wage disparity. This bill also adds stability and predictability to the rate system by moving from inflationary adjustments every 5 years to every 2 years and eliminating the regional variance factor beginning in 2022. This legislation was brought to me by the Best Life Alliance, and that includes a broad range of disability advocates and provider groups. And we do have a couple testifiers today. Mr. Chair, first it looks like Mr. Goodnow.
Mr. Goodnow, welcome to the committee. Please introduce yourself and give us your testimony.
Mr. Chairman, members of the committee, my name is Kevin Goodnow, representing the Minnesota Organization for Habilitation and Rehabilitation and also the broader coalition of the Best Life Alliance. Just to give you a little context about the bill, this is a result of a couple months of work with the Best Life Alliance in talking to the Department of Human Services and receiving technical assistance from them on how to best embed the 7% rate within the rate frameworks. Just to maybe give people a little bit more context, the rates, what I'm talking about when we talk about rate frameworks, we're talking about the rate setting methodology that sets the rates for services provided under waivered services for people with disabilities. That was a system that was put into place and starting the implementation was 2014, and we've been modifying it as we go forward. One of the issues we identified last session is we should embed the rates. This became a more urgent a few weeks ago when the federal government decided or directed that they would not allow the 7% add-on onto the rate frameworks. And so this is a solution to that rate cut. Right now, under current law, on July 1st, 27% of the individuals who are served under the DWRS system or whose rates are determined by the DWRS system will see a 7% rate cut in their rates. And for the remaining 73%, they'll see that when banding comes off at the end of 2019 or 2020, depending upon if we get the 7th year banding. So this is a solution to that problem. Representative Schomacker did a good job of identifying the 3 elements that we're looking at in order to, first of all, stop the cut, but also add additional stability to the system. With that, I appreciate the opportunity to speak, and we do have some other folks to testify on behalf of the coalition.
Chair Schomacker, do you have other testifiers?
We do. I believe up next we have Lynn Noren, who is the president of RISE Incorporated.
Members will go through the testifiers, and then if you have questions, you can recall them back to the desk.
Mr. Chair, members.
Please introduce yourself and welcome to the committee.
Mr. Chair, members of the committee, I'm Lynn Noren. I'm president of RISE Incorporated, which is a nonprofit organization that serves nearly 3,000 people with disabilities throughout the Twin Cities metropolitan area and across central Minnesota. I've been heavily involved in the DWRS rate setting issue since 2010 as part of that state's advisory committee. My organization is also a member of MORE and part of the Best Life Alliance. At our organization, over half of our budget comes from Medicaid funds that are paid through the disability waiver rate setting process. The 7% reduction required by CMS and outlined in the letter that you received from DHS would be a reduction to our budget of over $850,000. It's not possible to adjust for that significant of a cut without drastic reductions in staffing and benefits. As a community of organizations serving Minnesotans with disabilities, we worked really hard to gain those rate increases involving the people we serve, their families, our team members, and other advocacy organizations. Those increases were hard fought at the legislature with hours of meetings, testimony, and discussion. We engaged in this difficult advocacy year after year because we believe our state needs a disability waiver rate setting process that first supports people who have disabilities in living their best lives possible, and that recognizes the incredible value of the staff that provide these services day after day in every part of our state. To have all of those efforts eliminated in action that was unexpected and without open discussion was very disheartening to providers and other community-based service stakeholders. I cannot imagine going back to my team members at RISE and the people we serve to share the news about how this will impact our services. All increases that we receive at the legislature go primarily to increasing wages and benefits at RISE. Unlike other businesses, we have no influence over our pricing. except by action of the legislature. Even with the adjustments that we've made since 2013, we remain in a crisis in terms of workforce. At RISE in 2017, we had over 40% turnover in our direct support roles. This constant churn of employees has an impact on the quality of services that we all can provide. In my 38 years at RISE, I've never seen as challenging a time related to workforce as we are in today. I feel confident that we can work out a solution that is data-driven to meet the requirements of CMS. The Best Life Alliance has already been meeting with the department to develop potential solutions. We will need your partnership and support and action to assure that needed resources are in place for a disability waiver rate system that is so integral to our ability to offer access to high-quality community-based services to people in Minnesota. Thank you.
Thank you for your testimony, Ms. Noreen. Chair Schomacker, do you have another testifier?
Thank you, Mr. Chair. The last testifier we have today is Paula Hart from Volunteers of America.
Welcome to the committee. Please introduce yourself and give your testimony.
Thank you. Good morning, Mr. Chair, members. My name is Paula Hart, and I'm President and CEO of Volunteers of America, Minnesota. We have been providing community health and human services in the state for 122 years this month. We are also a longtime member of ARM and a member of the Best Life Alliance. We serve 26,000 Minnesotans every year, and many of those are people with disabilities who would be affected if this bill is not passed. So I'm here this morning to support House File 3191 as amended. As Ms. Noren said, the majority of our rates go to support the professionals who in turn support people with disabilities. We would ultimately be cut $400,000 annually, and the majority of that would need to come out of wages and benefits if this amended bill is not approved. I have long-term direct support professionals who tell me today that they could go to the corner fast food place, I won't name them by name, and make more than they make after working for decades supporting people with disabilities. We cannot make this situation even worse. We have retailers who are sending out bonuses and increasing their starting rate to $15 an hour when our starting rate is $11 or $12. There is no way that we can take another $400,000 out of the pockets of these very, very dedicated direct support professionals. So I urge you to stop the cut and support House File 3191 as amended, and appreciate your time this morning.
Thank you for your testimony, Ms. Hart. Chair Schomacker, any additional testifiers?
Thank you, Mr. Chair. That concludes my presentation.
Okay, with that, members, any questions for the testifiers at this point? Representative Moran.
Thank you, Mr. Chair. To Representative, I think this is a good bill, but I just want to reiterate what we just heard from the testifier, that this increase goes to the workers. They deserve it. They're hardworking, and they need to take care of their families also. So my hope is that we look at the workers, not shareholders and other folks, and that we give them a much-deserved increase. Thank you.
Any other questions, members? Seeing none, is there anyone else in the audience who would like to testify on this bill? Seeing none, Representative Liebling, I understand you have an A2 amendment. Would you like to offer that amendment?
I would, Mr. Chair. Thank you. I would move the A2 amendment.
Representative Liebling moves the A2 amendment. Do you want to give a brief explanation of your, would you like to brief us on? I'd like to keep it brief too, but.
I will present the amendment. Thank you, Mr. Chair. Right. So this is an amendment that, I think everybody on this committee really is extremely sympathetic to the problems that the testifiers have just presented. The problem of low wages for people who care for those with disabilities is really acute. And, we are in a situation right now, I have to say, in our entire economy when lots and lots of people are not making enough money to live on. And we have shortages of workers across many, many industries. I mean, we hear this everywhere across the state that people are struggling to find employees, but it's especially concerning in the area of support for people with disabilities where, you know, in many cases, it's actually a matter of life and death, whether somebody has a person there to support them and has the skills and the knowledge to interact with them. And so we completely get this. At the same time, from what I understand, the Department of Human Services is not able to really provide data to help us understand where the worst shortages are occurring, how much people are actually earning. And when we do things like we're trying to do with this bill and you know, make sure that we're properly compensating these people, we really don't have any way as a legislature of knowing what gets passed through to the workers and you know, exactly to really be able to deal with the problem, as they say, maybe with more of a scalpel instead of a hatchet, so that we can, actually it's kind of the wrong analogy because we don't want to cut anything, we want to add. Maybe we want to add with tweezers instead of a bucket, put it that way. So what this amendment does is it requires these agencies to just do some additional reporting so that we can, the Department of Human Services can have better data for us as we go forward. And, you know, I know it's never nothing to ask people to do more reporting. It takes some work to do some reporting. But we as a state spend billions of dollars doing this kind of work. And I think that's, I'm not complaining about that. I think most Minnesotans really are proud of the fact that we support people with disabilities and we support elderly people and we have these waiver programs. I think it's one of the great things about Minnesota. But at the same time, we have a fiduciary responsibility to try to use the money where we need it the most and make sure that we're providing these services. So that's what I'm doing with this amendment. This has come forward before as part of other packages, and it originally actually grows out of a report that the OLA did for us, I think about a year ago, and it was kind of a recommendation that they had made and was worked on. I think the OLA and the Department of Human Services had you know, the items that are in this amendment, I didn't make them up. They came from, I think they came from the Department of Human Services and the OLA. So anyway, so that's the amendment, members. And I guess I'd like to hear what Representative Schomacker has to say.
Thank you, Representative Liebling, for explaining your amendment. Chair Schomacker, do you have any comments on the A2 amendment?
Thank you, Mr. Chair and members. And while I agree with quite a few of the points that Representative Liebling had made on this, I do see this as a mandate onto the providers at this point, and without a funding or an extra funding boost from it, it would be more on the lines of an unfunded mandate. So I would ask that you oppose the amendment.
Thank you, Chair Schomacker. Any other discussion, members, on the A2 amendment? Representative Liebling.
Well, thank you, Mr. Chair. And I guess, you know, an unfunded mandate, boy, Representative Schomacker, we're funding these people. We're funding them a lot. And I think that when they're getting public money, you know, and I'm not complaining, as I said, I know a lot of them are really struggling. But the testifier from Volunteers of America just told us they support 26,000 people. And the majority of their money goes to support these people who are supporting, I think that was her clients, right? That was the number of clients, 26,000.
Total 26,000, some of whom are people with disabilities.
Okay, some of whom are people with disabilities, okay. But, you know, when we've got, these are enormous operations in some cases, and some of them are nonprofits, some of them are for-profits. We just don't have a handle on where this money is going. And so, Mr. Chair, I think this is so important that I would like to ask for a roll call on this amendment.
Roll call has been requested. There will be a roll call. Yep, we still have discussion. Representative Quam.
Thank you, Mr. Chair, and I was sort of shocked and amazed that the author of this amendment said we're funding them a lot. Ask the people that are working out there, we're funding them a lot. I know we spend a lot of money in HHS, but I think looking at ways to decrease the burden of the mandates where we can increase efficiency to where they don't have to be spending all these hours doing the paperwork and et cetera, would open up, maybe a little bit more of the money that we're apparently spending a lot to actually go to the workers. So I guess you'll find out what my vote will be on this amendment.
Okay, Representative McDonald has nothing to say. Oh, Representative Halverson.
Thank you, Mr. Chair, and perhaps somebody wants to comment, but with regard to the information that is being requested in this amendment, and it sounds like this is an outgrowth of some work and recommendations that we saw from the Office of the Legislative Auditor about managing these public dollars. And the goal of that, I think everybody has stated here, of making sure that workers are benefiting from any increases that we pass along, which I think are vitally important increases. It seems to me that the information that's being asked for is information that employers would have. It doesn't seem like we're asking for any information that they wouldn't have. They know what they pay their workers. They know the number of hours people worked. They know what their retention rates are. They know what they pay in benefits, and they know what they pay in overtime. So it seems like this is information that they would already have and would be able to pass along so that the DHS and the legislature would have an idea of how these increases are having an impact, and if they're having the desired impact that we're all looking for, which is to reduce vacancy rates and improve the economic benefits to the workers in this situation. So if anyone wants to comment on that, I think that would be helpful.
Any other discussion on the A2 amendment? Seeing none. Oh, Representative Leadley.
Thank you, Mr. Chair, and thank you, Representative Halverson, for that. Last night, the Ways and Means Committee met, and we had a lot of discussion about MNLARs, right? And the Republican majority put forward a bill that was extremely detailed, trying to, the folks who are working to try to fix MNLARs, giving them very specific marching orders as a way to try to get control over what's happening in that area. And the testimony was that it was so detailed that it was going to actually impede fixing the problem. But that didn't deter the majority. Here we've got a situation where we're spending a ton of public dollars, and we all agree that we want to get those services out to the people that need them. All of us agree on that. But you all, or I don't know, maybe some of you are going to vote with me, I don't know, but it appears that the chair is really not that interested in making sure that we actually know where the money is going. That's all this does. And if we put this on the bill, we can continue to work and, hear from people if there are particular items here that are too burdensome, if they don't have the data, as Representative Halverson's talking about. But it just frankly blows my mind that the people who put themselves forward as fiscal conservatives who want to shrink government, this is a huge item of spending for the state. And we want to make sure the services are provided, but my gosh, we better make sure that we know where the money is going. And this is just a tool to help us know that. It just, we talk about this all the time, that these folks are underpaid, but maybe some of them are underpaid and others aren't. We don't have any way of knowing. We don't have any way of directing our additional funds to the places where it may be most needed. Who knows what we may find out from this? We may find out there are certain regions of the state that are hurting more than other places. It may be your very own district that's getting shorted in some way and you wouldn't even know it. So I just think members, I mean, I feel it's unfortunate to have a roll call on something like this because we should just have, we should have agreement around this. So I don't know, Mr. Chair, I mean, is this something, I guess I'd like to ask the chair, is this something that we could continue to work on going forward and actually, would you be open to this? If we remove the roll call, can we, this is going to finance, I believe. So there's another opportunity to continue to work on this. But I just can't believe that the party of fiscal responsibility, so-called, doesn't want to find out where our money is going.
Chair Schumacher?
Thank you, Mr. Chair and Representative Liebling. I would be interested in continuing the conversation. I would prefer that the amendment not go on this bill, but if we were to work on things as it goes forward to Health and Human Service Finance, I think we could find a workable amendment to bring on there for you to offer.
Representative Liebling?
Okay, well, with that assurance, Mr. Chair, I will remove the roll call. But I really, I'm not guaranteeing that I won't bring an amendment on the floor or so on if we don't, in fact, do something about this because, we will never have enough money in this state to spend it where we don't know where it's going. And I know that's hard in a lot of the things we do. And this is, these kinds of services are very complicated. I think few of us actually totally understand how this whole system is working, but, I think we all owe it to our constituents and to the people who are receiving the services to fully understand, because our constituents think that we're in charge. And then, are we? If we don't know where the money's going, I don't think we really are in charge. So I will remove the roll call, Mr. Chair.
Representative Liebling removes her roll call. We do have one additional member who has a question. Representative Olson?
Thank you, Mr. Chair. As it relates to the discussion on the amendment and how this is going to move forward, would the bill author, would Representative Schomacker, would you be able to just point to some places where you do see with the bill as it stands, if we don't accept this amendment, where there are guardrails in place to make sure that, point to wherever, you see that it's satisfactory in believing that the satisfactory guardrails and sort of the checks and balances and accountability are currently in the bill that make sure that the wage increases go directly to the workers?
Chair Schumacher?
Thank you, Mr. Chair, Representative Olson. I would have to review the bill again to make sure on some of those points, but I would also refer to the A1 amendment on page 9, that there are references on reporting to know where the money went.
Representative Olson?
Thank you, Mr. Chair. And I would just share the similar concerns raised by Representative Liebling with her amendment, that I do hope that we have continued discussion then if this amendment does not go on, to make sure that we have more of a robust discussion, to make sure that we are in fact making sure these wages go where they need to go to the folks doing the work.
Thank you, Representative Olson. With that, Representative Liebling renews her motion to adopt the A2 amendment. All those in favor of the amendment say aye.
Aye.
All those opposed say no.
No.
No. The amendment fails. Any further discussion on the bill, members? Seeing none, any final comments, Representative Schumacher?
No.
With that, Representative Chair Schumacher renews his motion on HF 3191 as amended to be re-referred to the Committee on HHS Finance. Those in favor of the motion say aye.
Aye.
Aye. Those opposed to the motion, same sign. Hearing none, the amendment passes.
Thank you, members.
Motion prevails. With that, we can move on to the next bill. House File 3191 as amended is re-referred to the Committee on HHS Finance. With that, we have House File 3193. Representative Schumacher moves House File 3193 to be re-referred to the Committee on HHS Finance. Representative Schumacher, I understand the DE amendment is an author's amendment.
Yes, Mr. Chair, I'd like to move the DE1 amendment.
Representative Schomacker moves the DE1 amendment. All those in favor, say aye.
Aye.
Oh, we want to have testimony first. Yeah, okay. Representative Schomacker, do you have a testifier?
Yes, I'll have Ms. Noren present on this amendment as well.
Ms. Noren, please introduce yourself and give your testimony.
Mr. Chair, members of the committee, again, I'm Lynn Noren, and I'm the president of an organization called RISE. I won't go through all of that again, but we are very excited about the new employment rates that were passed last session. Our state organization, MORE, worked very closely with the Department of Human Services and other community organizations to advocate for these new services. The employment exploration, development, and support rates will assist people that we serve in having the support they need to achieve community employment. There are, however, a few challenges that require more time for implementation. The department's work plan called for a 6-month phase-in of training and planning once the approval of the new rates was completed by CMS. At this point, the rates have not been approved by CMS, and we don't believe the necessary infrastructure is in place to support a smooth transition. Our concerns relate to taking the time needed to assure the implementation goes well. An example of our concerns is the overlap in services today between these new employment services and day training and habilitation. Some individuals today have jobs as part of their day when they receive DT&H services. And immediately upon implementation of the new rates, banding ends for the providers' DT&H rates. For many providers, this will be a significant decrease in funding with no change in the service to the person served. Providers need more time to plan and adjust to the changing rate structure. We also feel really strongly that more time is needed for service planning to assure that lead agencies have the training and information they need and are ready to correctly authorize the new services. We are advocating to use a transition period for implementation of the new services so that we can be sure that it's done in a thoughtful and strategic way. We are committed to our collaborative work with the department to work through the process details necessary to ensure that these new employment services end up being viable option for Minnesotans with disabilities as they work toward their employment goals. Thank you so much.
Thank you for your testimony. Members, any discussion on the DE amendment? Seeing none, all those in favor say aye.
Aye.
Those opposed, same sign. The motion prevails. The DE amendment is adopted. Representative Schomacker, please give a explanation of your bill as amended.
Thank you, members, and thank you for adopting the DE1 amendment. That amendment worked with the transitional period for employment services, and rather than changing the effective date as the original bill had. The bill brought forward, of course, with more in mind with this, as you just heard the testimony there. The bill proposes transition periods for the implementation of new employment services under the DWRS system for individuals that have banded rates for day training and habilitation. Those additional services are options available to Minnesotans with disabilities working towards their employment goals. However, the transition is complex and related to how services are billed and how they are authorized, and is even more complex when we're working between the banded and unbanded rates. In an effort to ensure the transition to these new employment services happens in a thoughtful and strategic manner, this bill proposes to stagger the implementation of these new services.
Thank you, Chair Schomacker, for your testimony and explanation. Is there anyone else in the audience who wishes to testify on this bill? Seeing none, members, any discussions? Any questions for the author of the testifier? Seeing none, any final comments, Chair Schomacker? Okay, thank you, Chair Schomacker. He renews his motion that HF 3193 as amended be referred to the Committee on HHS Finance. Those in favor say aye. Aye. Those opposed, same sign. The motion prevails.
Thank you, members.
HF 3193 as amended is referred to the Committee on HHS Finance. Okay, the next bill on the agenda is House File 3169. Chair Schomacker moves HF 3169 be re-referred to the Committee on Civil Law and Data Data Practices Policy. Chair Schumacher, please give a brief explanation of your bill.
Thank you, Mr. Chair and members. This bill is just me today. What it does is it adjusts the background study requirements, as you can read from the bill summary. What we're trying to do here is reflect what child development research has told us about children and the process of background checks and fingerprinting. And so what we've learned is that process makes children feel like criminals in their own homes because they can't differentiate between the fact that they're getting fingerprinted and that they did something wrong, even though they hadn't done anything wrong. And the studies have shown that this has increased the psychological issues that come through in the development process, and it is increasingly difficult for children who already have some type of issues that they're dealing with and have been adopted through the foster care program and have been adopted so that they are just residents in the home and not foster children in the home, that these background studies and the fingerprinting just adds to their stress and the things that they're dealing with. And so I would ask members for your support.
Chair Schumacher, do you have any testifiers?
No.
Okay. With that, is there anyone in the audience who wishes to testify on the bill? Seeing none, members, any discussion? Representative Halverson.
Thank you, Mr. Chair and Chair Schumacher. Can you say more about the studies that you are citing with regard to the reactions of children to this action?
Mr. Chair, Representative Halverson, I don't have those studies with me today.
Mr. Chair?
Representative Halverson.
Can you say where they were from, or were they peer-reviewed, or who conducted the studies?
I can get back to you on that.
Okay. Any other questions, members? Representative Liebling.
Thank you, Mr. Chair, and thanks, Representative Schumacher. I guess I'd just like to understand a little more about this. You said you don't have any testifiers on this today?
That is correct, Representative Liebling.
And, Mr. Chair, if I may, Representative Schumacher, is there anybody that is opposed to this?
Representative Liebling, Mr. Chair, Representative Liebling, from the time that the bill has been introduced and posted, I have not interacted with anyone who has any opposition to the bill.
There is a 10-page packet inside of your, with the bill that you've been given. They did want to testify, but they weren't able to make it this morning. So I'd encourage members to take a look at that. Yeah, hopefully it's there. Mr. Kyrie, do you want to explain that, why it's not there?
It should be in 3573. I'm looking at the insurance.
Okay.
We'll take a moment for members to check that out if they want. Representative Branson.
Well, I see, is it from childcare providers? Okay, so members, we're going to be hearing a bill, no? Okay, so we got this same issue with childcare providers, that they've been wrapped up with this fingerprinting at the age of 13 to 17. So all across the state, when I've done my traveling, that's probably one of the many concerns that the providers have, is that the fact that their children are being fingerprinted. And I know foster parents have come to me with the same concerns. So I would suggest that we support Representative Schumacher's bill. And in that packet, yes, indeed, there is some testifiers. You may see some testimony from child care providers on the fingerprint, but that does extend to those that are doing foster care as well.
Any other questions, members? Representative Liebling.
Thank you, Mr. Chair, and thank you, Representative Franson, for that explanation. Has DHS expressed an opinion on this bill?
Chair Schumacher.
Thank you, Mr. Chair. Representative Liebling, they have not with me expressed any opinion.
Representative Liebling.
Well, okay. I guess I don't have any other questions on it. I think, I guess, members, I feel like there were more ins and outs to this than we're really discussing here today, and I'm a little bit uncomfortable because we're not sort of getting the full thinking behind it. I mean, I'd sort of like to understand why they're doing it in the first place and, what the impact might be. I understand, this is sort of a difficult topic. I mean, I'm more familiar with it just from the discussion in the childcare area that Representative Franson was talking about, but, it's trying to strike the right balance between not making people feel like criminals who aren't and, are having their privacy invaded in some respect, and also the potential safety impact that I assume is the reason for doing this in the first place. So I just feel like we're not having a full discussion of it here, and I'm not very comfortable making the change. I mean, I'm not saying I'm opposed to it. I just feel like I don't have enough information to make a good decision here today.
Representative Sandsteed.
Sandstead. Thank you, Mr. Chair.
Okay.
This is just a clarification to a statement that Rep. Franson just made in regards to the documents we have on the child care workers and the fingerprinting concerns that they have. You said it extends to the foster care workers as well. Have you had a conversation with foster care workers, or do you have documentation of any of that?
Representative Liebling or Franson.
Thank you. No, I didn't realize that we were going to have to document personal conversations that we had with people.
Mr. Chair, thank you. I'm curious, just for support of this, because this bill is specifically for foster care workers rather than child care. I'm not disagreeing about the child care issue, but we do have a 10-page document supporting their concerns in the realm of child care. I'm just wondering if we have anything in support of foster care workers.
Representative Franson.
Well, that's Representative Sandstead. That's why I had mentioned the fact that this dealt with child care providers, in case some of you over there were confused on why it didn't say foster care.
Thank you. And just one more question for the author. Could you clarify again, Chair Schomacker, who brought this bill forward? Is this a bill of your own, or did a constituent, or did somebody come to you and ask you to carry this forward?
Thank you, Mr. Chair, Representative Sandstead. This bill was brought forward to me from the foster care organizations.
Thank you, Mr. Chair.
Okay. Representative Crecia.
Thank you, Mr. Chair. And members, just by way of background, at least on the child care side, this came through Representative Franson's committee last year, and we talked about this. Some of the rules that changed on this, as I understand them, were some overzealous interpretations of federal push down to state. And there was we had long conversations with people at DHS. There were some individuals that interpreted some federal rules, like I said, over broadly. Members, I would speak in high support of this bill because the foster care problem that we have now is we don't have enough of them. And this is what's stopping us from getting more. It's parents that are getting worried about, do I have to fingerprint all of my kids just to take care of the kids in my community? So I would caution us not to make more out of this than it is. We already do extensive background checks on many of the other kids that are in there. And I'm just going to speak strongly in support of this. We're going to have less foster care parents and families if we continue to put them through the rigmaroles of the judicial system like this and treat them like criminals when they're just trying to help.
Representative Quam.
Thank you, Mr. Chair. And members, I have a bill out there that has to do with some of the issues that foster parents are having. And through those discussions and the fact that I'm also on the subcommittee on child care and have talked with many child care providers, parents tend to be protective and worry about their children. And there are concerns, and as was mentioned by Representative Crecia, we have a shortage. We don't have enough foster care families. We don't have enough daycare families. And if you listen to them, and it's common, they feel some of this is odorous, especially since the federal requirements do not require minors to be fingerprinted. The state is the one that says, oh, we're going to extend it to the minors. And I think that's what is meant by these bills coming forward. And I can say that I have talked with foster families that have this concern. And I treat those conversations confidential unless they say, oh, then I say, write a letter and we'll have it entered in as testimony.
Any other questions, members? Representative Liebling.
Thank you, Mr. Chair. I wonder if DHS, somebody's in the room that could come down and speak to this a little bit, because, I Representative Krish, I hear you on the problem about needing more foster families, but, I also sometimes hear from foster families or from kids who've grown up in foster care who've suffered abuse in foster care. I mean, that does happen too. And I don't know if fingerprinting minors in foster care helps that or not, but I'd like to understand a little more, if this is just an overreach and a misinterpretation of requirements, or if there's something real, some concern behind the fact this is being done before we just remove it.
The department evidently has come down. Please introduce yourself and give your testimony.
Mr. Chair, Patrick Carter from the Department of Human Services. Sorry, Representative Liebling, I was walking down. What was your question?
Well, thank you.
Representative Liebling.
Thank you, Mr. Chair. Thank you for coming down. I just would like to hear the department's take on the bill. If you could just give us a little background about why we're doing this fingerprinting. Have there been incidents where we've, uncovered anything that's been, does the department have a safety concern if we were to remove this requirement? Can you just kind of give us the landscape of what, of this bill, what's going on here?
Mr. Carter.
Mr. Chair, Representative, the change that is being proposed here would be undoing a requirement that passed in law in 2014, where the background studies conducted by the Department of Human Services were converted from a name and date of birth check to fingerprint-based studies. For child foster care studies, those checks were onboarded into the system starting in 2016 into 2017. By converting studies from name and date of birth checks or from fingerprint checks to name and date of birth checks, at the state level at least, they search the same databases at the Bureau of Criminal Apprehension. However, there is the potential loss of one piece of information by switching from fingerprint-based studies to name and date of birth studies.
Or the other way, I think, right?
Yes, thank
Yeah.
you. From fingerprint to name and date of birth. And that is what's called an offender status. It's information we at DHS receive from the BCA that if an individual has a criminal record in Minnesota, it indicates that there could potentially be a record in another state. So by making that transition from fingerprint to name and date of birth, the BCA would no longer give us that indication. However, there could be potential remedies to kind of backfill that loss of information with some additional changes to this bill.
Representative Liebling.
Thank you, Mr. Chair. Thank you for that explanation. So if this bill were to become law, the department could and still would do a background check on the minors who are in foster homes. They just wouldn't do it through fingerprinting. Is that what I'm understanding? And I remember when we went to that fingerprint system, and it was pretty controversial because, and it wasn't just for this, it was for, everybody who's getting a background study in the DHS system. And it is intrusive, and there were some problems that sort of because of needing to, that we had to do it for certain reasons, that we couldn't get information that we needed otherwise, as you're explaining. But so if we were to remove this for these younger kids, would the department still be doing a background study on them then, just with name and date of birth, just to, know that they don't have a in-state criminal record? Is that kind of what you're explaining here?
Mr. Carter?
Mr. Chair, Representative, that's correct. If this bill were to be implemented, there would still be a study on minor household members in child foster care homes. However, it would use name and date of birth information instead of fingerprints.
Representative
Okay.
Liebling?
All right, thank you, Mr. Chair. Thank you. That's comforting, actually. I mean, it is, I don't even know if that name and date of birth study is, how important that is, but at least it's not going from something to nothing. So that makes me feel a lot more comfortable with the bill. Thank you.
Representative Moran?
Thank you, Mr. Chair. Just so we can better understand what we're doing here, and not that we are confused or anything, we just want to be more informed. And so I'm just wondering, and I understand that there's a shortage of foster parents right now, and it's very complicated for them now, and, we need to do better in a lot of areas around within that department. But I'm wondering, for like kinship families, do they have to also do a background check for youth in their homes?
Mr. Carter?
Mr. Chair, Representative Moran, I don't have that information in front of me, but we'd be glad to follow up with kind of the background set requirements across child foster care, kinship, and adoption assistance programs. There's varying requirements across all three of those, and I'd be glad to follow up.
Mr. Chair.
Representative Moran?
I think that would be helpful because we also have a shortage of kids going into kinship care because of the many barriers that are in place for them also. And we do need to recognize that we can't make assumptions that because someone is taking on the job of being a foster parent, that everyone in the household is clear and upstanding or do not have a background as a youth. So I think it's really important that when we're looking at our kids that we're pulling out of homes, and we say that the first priority is their well-being, that we're not doing due diligence to make sure the home that they're going into is a safe environment also. So, as much as we have a shortage of foster care parents, that should not be our priority because it's not about the home, it's about the child. We want to make sure that child is safe. So for that reason, I cannot support this bill. And I would like to have more information on kinship care and what type of background information is needed in those households.
Mr. Carter, any comments?
Mr. Chair, Representative, we'd be glad to follow up with that information.
Representative Quam?
Thank you, Mr. Chair. And a few years ago, when I and my wife provided kinship care, they did not require the same, you were exempted from the normal foster care background review, or, are your windows this size, et cetera. And this bill doesn't touch on or affect one iota of what you're asking about, because, we aren't, it just is not relational. And if you want to generate a bill that would make kinship care just as difficult as foster care, because it's family members, then you're welcome to. But don't burden this bill, which is trying to do something for a reason that's, totally outside it. And let's stick to the bill.
Representative Moran?
Mr. Chair, thank you. Representative Kwan, can you define what is one iota? What does that mean? Because I believe that this is not about kinship care. It is about the foster care and then them being exempt. That is my comment. I'm not trying to burden anyone, but this is about the well-being of the child. And I hope that you can see that, and that when kids are being pulled out of their homes and who are traumatized and they go into a foster care home setting, that's important too, that we are ensuring that they're going to be safe. And so that's my comment about this. I'm not trying to railroad this bill, but my concern is about the child.
Members, this bill does have another stop, so if there's some disagreement we're just about out of time, so if there's some disagreement, you might want to take it offline afterwards. Representative Halverson?
Thank you, Mr. Chair. And I think that, unfortunately, Representative Schomacker, I think your bill is a kind of is seeing some concerns just for lack of information. I think that this is a really important thing to talk about, but I think that a lot of us need a lot more information before we can make this decision. I'm curious, for example, if these fingerprint studies versus the name and dates, birth date studies can dig further into criminal backgrounds of youth who are who get into the criminal justice system because we do treat their information differently than we do an adult who gets into the criminal justice system. That becomes public information. We don't treat youth data the same way. And so I don't know if that's one of the reasons that this was put into place. And maybe we don't even need to find out about it now, but if we hear, when we hear this bill again, I would really suggest that we get some good information about why this was put into place in the first place and what information we might lose out on if we change this, because we do have to ensure that the children that are being placed in foster care are being placed into a safe place. If we can get there with name and date of birth, then that's fine. But I think that based on what we've heard today, we don't know that for sure. And so knowing that for sure would be really helpful.
Mr. Carter, any comments?
Mr. Chair, Representative, we'd be glad to follow up on kind of the juvenile justice record piece of that for you.
Representative Creasha.
Thank you, Mr. Chair. And just very quickly, and I wasn't going to speak again, but members, I want to caution us. I hear what we're talking about. We've talked, folks on the other side, that we've talked about these issues, but be very wary of what you're about to do if you argue against this. We have a huge problem with minorities and disparities getting into this system. And you are about to ask, if we were to stop this, you're about to ask minority and disparity families to have one more stronger interaction with law enforcement that they don't need. And I think we have to be very careful. We want to be opening and becoming to allow more families to be more representative. We need more foster cares of like kids, not less. I understand our concerns of security and all that. Fingerprinting is not going to prevent that. Fingerprinting is not going to talk about the intent of a kid or the intent of a family. There's way other mechanisms and backgrounds to do that. So I understand what we're doing, and I know why we're doing, and I know the questions we're having on a good intention. I'm just saying I think we're putting up some barriers and we're adding some layers that I keep hearing over and over in the child protection of why we have the difficult interactions we have with families and disparities and racial disparities. So I just have to throw that up as a caution.
Last question, Representative Halverson.
Thank you, Mr. Chair, and sorry I have to respond to that because I think that Representative Creasha, you have mischaracterized the discussion. I think that what has happened is that there's been a lot of questions raised that you and others can say what you believe and what you think and even maybe what you know, but we don't have the studies, we don't have the data, we don't have testimony about if we get to the questions that we're trying to answer with regard to security without the fingerprints. And as I said and others have said, maybe we do. It's just that we don't have that information to make that decision. If we can get that information to make that decision, I think that everybody would feel better. But for anybody who is going to take a vote on the safety and security of children in the foster care system, we want to be sure that we're taking a vote that someday isn't going to lead to a tragedy. And so it's simply more information that people are asking for. I don't think saying that we are going to vote against a bill because this is a bad idea or because we don't care about expanding the foster care system is a fair characterization.
Representative Creasha, your name was mentioned.
Thank you, Mr. Chair. That was never my characterization. I have not impugned anybody's intent. I've just said what I think is setting up barriers, and I've heard much testimony on this. I'm not speaking from a point of ignorance on this. That's how I bring it up.
With that, members, if you have additional questions or comments, I'm sure Chair Schumacher is open to talking with you about that. Any final comments, Chair Schumacher?
No, I understand how people are going to have to vote on this one, and apologize for not being better prepared for the committee on this bill, and ask for your support, but understand if you can't.
Thank you, Chair Schumacher. With that, Chair Schumacher renews his motion that HF 3169 be re-referred to the Committee on Civil Law and Data Practices. Those in favor of the motion say aye.
Aye.
Those opposed, same sign.
No.
The motion prevails. HF 3169 is re-referred to the Committee on Civil Law and Data Practices. With that, members, we will recess until the call of the chair at approximately 5:30. Please watch your emails.
Looking forward to that.